in entrepreneurship, like Silicon Valley, there's this mentality, and we had this on the early days of the campaign for Andrews, like move fast and break things, right? Don't ask for permission, ask for forgiveness, right? Just go, go, go. And that works in a lot of ways. And we're as a society are almost forgiving of that, right? Like if you look at Facebook or Google, where they were like darlings in the beginning, and now they're kind of villains because we gave them a little runway, and they, say what you will. But in healthcare, moving fast and breaking things means moving fast and probably killing people, right? Or really, really seriously hurting people's health. Like you can't be that cavalier in healthcare. Like how did that mentality kind of bake into where you frankly ended up starting your own thing?
You're right. And for Silicon Valley, I think there are some learnings there because it's tough to move fast and break things. But then actually, if we look back in the history of healthcare, we do see some of the answers. So if we look at how new medical devices or surgical techniques have been rolled out, from X-rays to MRI machines, if we look at how new drugs and medications have been rolled out as well, we have a lot of innovation in healthcare um, that has bubbled up across different countries and different parts of healthcare. And once we evaluate and show that it's relatively safe, it's about having a clear mechanism for rolling that out at scale. Um, because I think many systems are great at having, if they've got a new blockbuster drug to tackle lung cancer, making that available nationwide. But if we have a revolutionary technology or a digital platform that allows people to receive mental health treatment on their smartphone, and it's been shown to improve outcomes, actually rolling that out is pretty difficult. And we haven't created the networks and the pathways to make that happen fast. And I think that's the balance. We need to be able to evaluate and safely develop new innovations and solutions. But once we've demonstrated they're safe, we want to be able to roll it out super fast so that everyone who can benefit from them does benefit from them.
So is that a policy issue? Is that a business issue? Is that a bureaucracy issue? What solves that?
All of the above.
Great.
It's not. It's not straightforward. I think if we look at healthcare, it's complex. It involves a lot of stakeholders. It's regulated, and all of that tends to slow a lot of innovation down. And even, if you take how, let's say, Apple innovates the iPhone, um, the people who are using the iPhone and the people who are building it and the people who are trying to think of new ways to optimize different features are all the same people very frequently. And there'll all be people who are buying their own smartphones, and then they're going home in the evening and maybe they're kind of trying out a new app. And that tight alignment between those stakeholders makes it really easy to innovate, to improve, to adopt. I think in healthcare, it's very different. The people who are paying for healthcare are sometimes different from the people who need healthcare, who are different from the people who are administering or prescribing it, who are in turn different from the people coming up with new solutions, right? You've got patients, you've got professionals and physicians, you've got health insurance companies, hospitals, and then you've got people who are focusing on different forms of R&D, be it research scientists to data scientists to developers to people building startups. And so creating that alignment and the challenges with it, I think, are some of the reasons why healthcare hasn't been able to transform and embrace technology in the way that many, many other sectors already have. And it's been a bit left behind. The challenge that creates is how we also build businesses that align with government policies. Because again, if healthcare is more complex, it takes more time to build successful businesses that are sustainable. And that has an impact on business models. It has an impact on how they're funded, on venture capital. Um, one requires or needs to be more patient. It's very difficult to see the growth that we've seen with ride sharing also occur with healthcare services or digital first healthcare services. And that's why, we need a combination of governments and policymakers working with entrepreneurs so that we can create long-term sustainable solutions in healthcare. Otherwise, frankly, entrepreneurs and high quality entrepreneurs are going to be turned off building solutions in health.
You just hit something really, really key I never thought of before. And I imagine most people think about that. Where almost every other business, the people creating it are a form of a customer, or usually the customer. You know, if you're creating an app, you're creating something that you would want to use, right? You're solving a problem in your life. If you're a chef and you're going to cook something great, it's probably because you love food, right? And so there's a certain connectivity between the creation, the process of creating it, the delivery of the creation, and then the actual end product. But if you're trying to, let's say, cure cancer, let's say, and Alzheimer's or ALS or what, you go down the list, right? You, by definition, don't have that disease, you don't have that problem realistically, because if you're sick, you actually can't most likely create that. So there's a disconnect, I imagine, between the creator and the end user that's so void, right? I'm imagining this army of young people who understand new technologies helping 80 to 90-year-old Americans who grew up in a generation that didn't have that. Am I hitting that right? That's what I think you're saying.
You're exactly right. Exactly. And that's kind of one big challenge in healthcare. I think another one is that, unfortunately, the people who need healthcare the most are usually the ones who are least likely to use technology, right? To your point, someone who's got severe dementia, they're in their late 80s, they've had a hip replacement, it's unlikely they're going to just pop on a Fitbit and start monitoring their health, right? And and that presents an additional entrepreneurial challenge, but it also means that if we're not careful, healthcare can actually widen inequalities because it's the healthiest people who are going to use the latest technology rather than addressing those inequalities.
Talk to me about your company, Sarah, because what I love about your company is you tie it to the human side, because you're doing a lot of at-home healthcare work, which is some of the most important and less, almost like least talked about form of work. A lot of people think we can have an army of home healthcare workers when it's a really, really hard job. It's physically taxing, it's demanding, it's sometimes infuriating. Tell us about what you've done and like how you've looked at that lens we were just talking about, where like the disconnect in healthcare products and healthcare innovation creation, if you will.
Yeah, so I had the entrepreneurial bug, and I think after spending my time in the NHS, I realized there was this disconnect between the people who were receiving health technologies and the benefits from them versus the people who really needed it. And I think it hit home the hardest when my mother actually fractured her back and she needed care and support at home. And we as a family, we tried to organize it, and it was really difficult because we tried calling different home care companies, and I did, and most of them were just too overwhelmed and too busy. They had people they were already looking after. They didn't have carers available. And even when I called them and I said, "Hey, you're busy, but do you mind dropping me a line back?" Sometimes it would be days before they called me back. And that was a real shame and a challenge, because at a point of crisis, you would go to a care company for peace of mind, but actually they were making the journey more difficult. And it's not because they're not motivated. I think there are a lot of very motivated, very resilient, very good-hearted people in the care sector. It's just that they don't have the tools. And if you walk into a typical home care agency, they're literally using a whiteboard, pen and paper to manage their day-to-day operations. I mean, I've been in home care agencies where they're not even using the internet. And so with those tools or lack of, it becomes really difficult to manage your day-to-day and to organize for caregivers to visit people in their homes, look after them, and then go to other visits. It's like Lyft trying to coordinate its operations without using any form of technology.
No
or
one has
smartphone.
smartphones. Yeah, it's like you're.
Yeah, it's almost impossible, right? And so that really hit home, and that kind of for me was an inspiration for trying to build a digital first home care company that really was able to push the boundaries on empowering older people to live better lives in their own homes rather than going to care homes or hospitals or elsewhere, and to use technology to give people the tools they need so that they can provide great care rather than them being continuously overwhelmed and caught up with administrative work, a bit like when I was a junior doctor and I spent most of my day doing admin and paperwork rather than actually focusing on patient care.
So in your model, you can find. But I'm assuming your mother could sign herself up, but you could probably do it for her as well. Like,
Exactly.
Is that kind of bridging the gap?
Exactly. So we digitize the whole care process, from how someone's onboarded to how carers are recruited to the matching of carers and users based on different characteristics such as time, location, the skills of the carer, the needs of the individual, automating a lot of the back office, which takes the headache out, and also digitalizing the user experience for everyone involved. The carer, the person receiving care, the family member, all of them have an app that they can use to monitor and manage the service. And it also, from a headquarters and operations point of view, it gives us real-time insights into the care that's being provided in someone's home. And that's really important because in a typical home care company, a carer will visit someone in the home and they will write up using pen and paper notes everything that happened in the visit because they're required to by the regulator and then go to the next one. But if something's gone wrong or the carer doesn't know what to do, apart from calling up the agency, which many of the times they're too busy speaking to other carers or trying to sort out another issue that's cropped up, apart from calling them, they have no way of contacting anyone and getting support. And that's an incredibly disempowering experience if you're a carer to go and visit someone. Let's say they're more drowsy than usual, they haven't been taking their medications, you don't know what to do, and then you've got to go to your next visit. That is a really, I mean, it's a very concerning, it's quite a scary position to be in. But by simply using our app, our carers can communicate with other carers, they can communicate with our team and the family, and it all happens in real time. So what is normally a disempowering experience becomes one where they feel comfortable, they feel safe, they feel supported in delivering a great care. And that's how we've used digital. And we've seen loads of metrics improve as a result, from the quality of the care to the staff experience to the way we're retaining staff. So that doubles actually after we've rolled out our app and given people it, to our ability to identify health issues in the people we're looking after much earlier on, because everything's digital, everything's real time, it's all connected, as opposed to using a very traditional system which sometimes takes weeks to pick up an issue. And it fundamentally allows us to provide a safer, higher quality, and more peace of mind service that also is financially more sustainable for the sector as well. We're able to pay caregivers better. We're able to charge less for care. It's a system that hopefully works in the best interest of everyone because we've been able to use technology.